HERCUS Community Sector COVID-19 Forum. I'd like to welcome you all here today and to recognise the traditional owners of the land upon which we all meet and to pay my respects to elders past, present and emerging. Since our last webinar just a month ago, the situation has changed significantly. We're now under stage 4 restrictions. We've got many industries and workplaces that are closed, and we've got many young people and families impacted by the closure of schools and childcare centres as well. Community organisations are still out on the front line. They're providing vital health and support services for vulnerable people and others who are at risk. Others are working out innovative ways to keep people connected and supported while they shelter at home. We at VCOSS extend our sincere thanks to the community sector organisations, to the thousands of workers who are out there doing their best to help every single Victorian. We know there are others who are working out innovative ways to keep people supported, and we really want to thank people for your critical work during this very, very important time. So today's webinar is particularly timely, particularly as we navigate what are new sort of permit arrangements for staff who are either having to go in to provide frontline services or who are working to support others as they move around the community as well. We are very, very lucky today to have Finn Romanis with us. Finn is the Public Health Commander, and he's joining us today in what I know has been a very busy and challenging week for him. Thank you very much for joining us today, Finn.
You're welcome, Emma.
I might just start with asking if you could give us a sort of general update in terms of the key announcements, given that we're moving so quickly. I know it's really hard for people to kind of keep track of what's taking place, so it'd be really great to hear that directly from you. Thanks.
No problem at all. Look, it's first to speak to everyone about how challenging this time is. Clearly, we're at an absolute critical point in the outbreak and the pandemic. With numbers jumping between 400, 700 new cases yesterday, over 400 today, 7,500 active cases across the state, and 10,000 people in who are close contacts under monitoring. Incredibly challenging times for everyone, including the sector. And clearly, one of the things we're doing now with these announcements this week and the restrictions that are coming into place over last night through into later into the week that I'll talk to in a second is trying to really ramp it right up now to drive the numbers down. I mean, we're in this second huge peak, and we really need to get things down and cut transmission off. As you know, and as everyone is aware, we are kind of fighting a battle here where the scorecard is between 7 and 10 days behind, both in terms of how many people there are of cases and also what that effect is on our community in terms of people being admitted to hospital and ending up in ICU and dying. So we really have to do everything we can now. So what the focus of these changes this week is around taking Melbourne to what's been called stage 4, which is really pulling back to absolutely the essential actions only and reasons to be out being incredibly limited to try and pull those opportunities for transmission or interactions between people to the absolute bare minimum. So that's firstly gone undertaken through this move to stage 4 in Melbourne and stage 3 in regional. It's really bringing home that critical message about mandatory mask wearing across the state, and it's also bringing in this the first step of 2 really important steps about workplaces where we're seeing so much transmission. So colleagues will have heard on the line that the first step was to introduce a direction to require permitted workers to be able to attend work and to set up an infrastructure around trying to really bear down on how we can just make sure only those are at work that really need to be, and then and that includes a permitted open working list. So I'm probably going into a little bit too much detail, but the architecture of it is that, and it creates a lot of challenges for workers and employers, but people in the sector are doing critical work that needs to be done, and clearly are captured by parts of the sector that can remain open because they have to. So a huge challenge for everyone, and thank you, just before we go into the detail, but thank you for everyone's efforts and all the contribution they've been making.
Oh, and a huge thank you to Finn, to you and to your team. And I know that you're working into the day and night in terms of looking at meeting the needs of the Victorian community as well. It might be great if you've got the opportunity, and any of you might need to take any of this on notice, but particularly we do get lots of questions around things like PPE and safe
Yeah,
ways to, new words, I guess, for many of us about donning and doffing masks and those sorts of things. Is there sort of general advice that you can give people, or sort of pointers that you're able to provide to help people, knowing, of course, we've got people working in a raft of different sectors, from those who are working in, community health
yeah.
environment, to those working in residential settings and others as well. So a huge variety of different
Yeah.
types of organisations that people are in.
So what I'd say is that um, we have the place where we've established a kind of the most clear and straightforward advice about personal protective equipment is in the general guide to PPE for healthcare. And so that's a sort of grounding that applies across health sector care and gives a concept of tiers or scenarios that require certain approaches. And in that guidance, which is a couple of pages long and is clearly in the PPE section on the DHHS website in COVID, gives you a good, I think if colleagues on the sector who are online and are interested want to just get basically grounded in what the deal is with PPE and how to stay safe, they can have a look at that document to get a sense of how it's done in the health sector. So then I would just say that it's really about the basics. It's about recognizing when people are ill around you. It's about hand hygiene, and then it's about just taking a careful approach when you're working with someone who's ill. So obviously, we need to all wear masks now at all times, including in the workplace. And that will help because it'll protect the nose and mouth against droplets and some of the greater risk. And it also is a kind of reminder to you to not touch your face. There's quite a lot of dual reasons and value in wearing a cloth mask when you're out and about in the community, or a surgical mask when you're working directly with clients. So there's that step, and then there's I think there's a bewildering amount of information out there on PPE, and it's the basics are the hand hygiene before and after procedures with people, wearing a mask when you're doing a splash procedure or something, if that's relevant in a particular setting, then having some eye protection, gloves and a gown if that's true as well. So the standard precautions. But it's certainly the case that it is good to practice these things. So it is good to practice the art of putting on and taking off your mask carefully. So not touching the front of it as you take it on, and learning to never touch the front of it. So I think I don't have a link to give you to a specific resource to access a trainer to come out to you, but I think it's about reading about the basics, keeping it simple, and just practicing it and turning it over and doing it as many times as you can.
Thanks, Finn. I think that's really helpful, because I think the point that you touched on is so right in terms of the bewildering amount of information, and the fact that advice that we've got, understandably, when we're looking at really significant change, is it changes by the moment. And I think it speaks volumes to the work that you and your team are doing, and the team across DHHS are doing, that, we're seeing constant sort of emails about things from PPE to work permits, etc. And it's that literal power of work that's just keeping going, and it can be quite confusing for people. And some basic tips such as the ones you've been through, I know for all of us like myself who are not used to wearing masks, it feels odd, so your immediate thing is almost to touch the very
Yeah.
places on the mask that you shouldn't. So that's really helpful as well. Are there any kind of observations around things like testing or other things that you wanted to perhaps touch on today as well? I know there's some of the questions that, we sort of see this shift as we've moved into the sort of the stage 4 component, but I know, again, it's one of those around the testing regulations, when you can and when you should get tested. It's one of those things that's kind of changed as well. And I wondered if perhaps you wanted to touch on that today too.
I think I'd go back to some basic messages about testing. So the greatest, as we've seen more community transmission in Victoria, unfortunately, we are seeing that the proportion of people who are positive for COVID amongst those who are tested is slowly rising. But fortunately, so many people are coming forward to get tested still, which is fantastic. So we're still at about a 2.8% positivity rate for testing. In other words, fortunately, 1 in 33 or almost everyone is still not having COVID who's tested, but we've got to find it and get ourselves out and away from people if we're symptomatic and we might have it, to stop it transmitting, because it's such a slippery thing. It's really easily transmitted, including while you're well. So So the message on testing really is still pretty straightforward, including for the sector. It's the focus is on anyone with a respiratory illness or an illness to get tested. We at various points when there's an outbreak or a specific setting that's affected by a higher attack rate, and there's actually COVID in the setting or in the facility or in the care home, we will do a round of testing of everyone, including well people. But broadly, the message to everyone across the sector is still, if you've got symptoms, stay off and get tested. If you don't have symptoms, look out for them. But we're not recommending sort of widespread testing of well people across that many sectors. There is some work going on with the highest risk sector in the meat industry at the moment, where there's some rounds of testing are going to be explored. But still a straightforward message: get tested if you've got symptoms. Stay off until you get a negative result. But if it's negative, stay off until your symptoms resolve, so you don't pass the rhinovirus or the cold virus onto all the other staff, and then they all have to go off and get tested, and so the cycle continues. So it's still a fairly key message: symptoms equals test.
Thank you. And in terms of, so generally, I guess if people have got questions, I'm mindful we've got some DHHS staff who are coming into the forum shortly as well. I think they'll be able to direct people in terms of where to go to just to flag. And I know, just for people watching, I know you will have the question around if you've got questions about permitted worker system and what services you can deliver and where do you get answers. We'll ask some of DHHS staff. So I just wanted to flag that at the outset here as well, because that's probably one of our burning questions at the moment, given that materials sort of coming through the night. I guess any other sort of key health messages that you wanted to touch on, Finn, before? I know you've got a very limited time window today, and mindful that you've probably got key questions that you're getting from community sector organisations as well. Keen to see if there's any sort of key things that you want to share with others before we move on to chatting with Andrew too.
Well, I think you've mentioned, Emma, about how critical it is for people to be clear what to do if someone's ill, and I think the basics of, or the foundation of, what to do when someone's ill at the setting is now being further strengthened through some workplace directions that are coming through Friday night. And essentially, I know I'm talking very high level, but I suppose I really want to transmit a view from public health to you in the sector that despite the breadth and the depth of all the things that are going on, it does come back to some basic principles to stay safe. And so when you've got a case in a staff member or resident, it's really again about isolating the person, doing some work to look at who's been around them. There'll be an obligation on workers and in workplaces to identify close contacts, be ready to give those to the department so we can get those people off and quarantined as close contacts. And so there's now more things that a workplace can do to get ready to take faster action, and especially isolating the symptomatic person, or the person who's been diagnosed with COVID or maybe COVID, and getting ready to participate quickly in a rapid conversation about how to clean and disinfect, and the identification of close contacts, and then quarantining of those people.
Thank you. And that's a really great observation, because it's one of the questions we get, and often late at night as well, saying this particular things happen at my workplace and I'm not sure what to do. So I think it's that part, as you say, around looking at what information you can gather and what's the key information that you need. So I take it from that as well. The key information you need is often around looking at very close contacts, those sorts of things as well.
Yeah, it's if and when we beat this thing together, we're going to do it because we get people who are potentially infectious quickly isolated, and we get people who are close contact of those people quickly quarantined. Those two things together, and then the cleaning of the workplace environment, those three pillars almost are going to really help us get ahead of this thing.
Yeah, thank you so much, Finn. Really appreciate your time
Thank you.
in being here today. I know on behalf of everyone in the Victorian community sector, and really the whole community, we can't thank you enough. I know last night I saw some of the messages being sent from, be it members of your team, DHHS, ministerial level as well. There were emails coming through after 1 a.m. I just think the amount of work that's being taken is just extraordinary. I can't begin to imagine how what a challenging time it is in your working life, as well as for you and your colleagues. So if you could pass our very sincere thank you on to you and your colleagues, we would just be so lost without you. And I just want to pass on our very sincere thanks. So thank you so much.
Thank you. Thanks, everyone.
Have a great rest of your afternoon.
Cheers.
Thank you. And while we're waiting for Andrew Cripps to jump on, he's going to be joining with us shortly as well. There was something that I did neglect to mention in my introduction. I did also want to mention the fact that we had endeavoured to get Auslan interpreters Auslan interpreters with us today. Unfortunately, we were unable to do that because I think, as you can imagine, they are in high demand at the moment. As a consequence, we do have live captioning available. So if you click on the CC button on your screen to turn that on, you'll be able to have live captioning from there. I did also want to mention, while we're waiting for Andrew to come in as well, that one of the other key things is we've heard loud and clear the messages around the process of frontline community services, if there's a confirmed case of COVID-19. And I have to say as well, for those of you who've either texted or emailed myself or members of the VCOSS team in the last few days around specific questions around permitted workers in your industry, how do you get permits, what about permits for childcare, etc. We are working at speed with people in the department and at ministerial level, etc., to get clarification on those. We literally had emails coming in from the team at sort of 2 o'clock this morning. So I guess I'd ask you to bear with us. We have lots and lots of emails from people individually. So if you haven't heard from us, that's why. We're waiting to get clarity, and we will be asking some of the DHHS staff who'll be jumping online in terms of the best place you can go to get the answers to your questions. It's not necessarily information that we've got at hand today. So what I'm going to do is, while we're waiting for Andrew Chris, I'm just going to do a quick intro because I'm hoping he's going to join us on the line very shortly. As you can imagine, Andrew's incredibly busy in terms of being the Emergency Management Commissioner for Victoria, and unsurprisingly is probably finishing off something else while he jumps into the call today. I'll do the introduction just while we're waiting at the moment. So as you know, Andrew is working out of the State Control Centre and he's overseeing our response. We're extraordinarily lucky that he is making the time to be with us today. We're going to step through a few sort of key issues with him around workforce shortages in residential aged care, and some of the things that perhaps we've seen on the public housing estates, and know that Andrew, as he stepped in to lead that response, some of the things they're really looking at for scenario planning on that front. So we'll be touching on that. While we're waiting for Andrew as well, I'll just mention to you, we're also going to have coming online, we do have a mental health focus today from Matthew HERCUS, who is the Director of Mental Health and Alcohol and Drugs at DHHS. We'll be hearing from Simone Corrin at DHHS around service delivery during stay-at-home restrictions, and she's doing an enormous amount of work in the disability space as well with some of her colleagues there, so we'll touch on some of those issues, as well as, of course, hearing from Agiri Alexandratos, who is a regular attendee to these forums and will be talking to us around some of the work he's doing around scenario planning as well. So we're looking forward to them coming on board. While we're waiting for Andrew to jump in, I think I just wanted to flag, we're also receiving a lot of questions around areas. I think it probably stems out of some of the aged care work around some of the residential services, whether they be for disability and others. So we're really wanting to touch on those particular areas. We know that's a real, it's causing significant challenges for community sector organisations who run residential services and other organisations where you might have a client who tests positive and looking at what's the sort of practice that you need to put into place in terms of, you know, having a workforce that needs to be isolated, making sure that you're able to take care of people and looking at some of the scenario planning that takes place. So I just wanted to again flag, we've had multiple questions along those lines, and quite rightly our member organisations have been raising those with us. So we're looking forward to being able to talk to Andrew and to the host of staff from DHHS that are going to join us to talk about those as well. So we're looking forward to being able to do that. We might be changing our order slightly, so just bear with me. I know the team is working to look at who is next in line, and this is probably one of the challenges we've all got as we're doing this from our lounge rooms, which you will all understand as we're all Zooming from home and doing our best to be able to step in. So just bear with me here while we're getting someone else in online. The advantage, one of the things we talked about in the lead into today's webinar was in the past we've been able to have people literally lined up in person, and we've got a new way of working at the moment. I can see that we've got Matthew HERCUS who's just about to join us. So we'll step back to talking to Andrew when he's available. I'll just wait till I can see Matthew's face before I formally hand over to him. So Matthew HERCUS is the Director of Mental Health and Alcohol and Other Drugs at DHHS. And we're going to, now I could see him there and he's just disappeared. So bear with me just for a moment. And we'll hear from Matthew, who's about to come back in, I think. I think there might be some problems with connection there, so that's okay. We'll just wait a moment. So after the last webinar, one of the themes that emerged, as you can imagine, was a significant issues around mental health and mental health responses. And we know as we enter into this next phase, that's likely to be even more important. Matthew, thank you for being adaptable and joining us a little bit earlier than was planned. Much appreciated. And perhaps, Matthew, did you want to kick off by sort of any kind of general messages that you wanted to sort of share around the really critical work you're undertaking on the mental health front as well? Thanks.
Thanks so much, folks, for allowing me to be part of the conversation. I understand these are critical conversations which have been in existence and have been playing their way out across the COVID experience now for some months now, of course, and with some room to go. Absolutely, and thank you to the VCOSS membership, of course, for all the work that VCOSS member organisations do and play in connecting people, connecting Victorians, and enabling us to get through this circumstance and this issue. I might just brief on a couple of things, maybe, if that's okay. Just brief on the mental health observance and some of the data and some of the experience we're observing. I'll then loop back to some of the responses that are being put in place. I'll also emphasise some of the responses that we're undertaking in partnership with the Commonwealth as well, just to give some context to those things, given that VCOSS members, of course, are in many cases not just state-based organisations. They have a footprint and a platform across a range of environments and a range of settings. So, as you suggested, Emma, it's certainly going to be a time of magnificent impact on the whole of community, the whole of Victorians, the whole of the country, the whole of the world. There's no disputing that. And where is mental health in this is a really important construct and conversation. Of course, it's right and it's appropriate that the very first effort around the pandemic was the effort through our physicians, our public health experts, talking about infections, tracing, contact tracing, and being prepared for the ventilator experience. That's right and that's appropriate. As things unrolled, though, and as stages and phases of community restriction or physical distancing or social distancing were started to become implemented or seen and observed as required to be implemented, very clearly our minds went to the impacts on the community. There are a range of different impacts. There are certainly those folks who have existing needs, who have those needs and those pathways disrupted because of those community changes, those support needs and those impacts. There's also a whole population impact here. There are folks, and many of those among us in the community for whom life has never been impacted in the way that's been impacted now, either in terms of employment, housing, structures, community structures, etc., are really fundamental and foundational. So taking those two things, there's certainly a need to shore up, innovate, enable a response to those folk that are part of the system, wherever that system of support may be now, but also look to mitigate and provide early intervention and responses and pathways for those who are experiencing, in many cases, potentially for the first time in their life, a major disruption, including affecting their psychosocial wellbeing. So we've been watching closely, I suppose, is the phrase, watching closely a range of things, working with VAHI, the Victorian Agency for Health Information, working nationally with our colleagues on the Mental Health Principal Committee and the National Mental Health Commission and others, working to observe the impacts. And we would have seen recently our colleagues across Beyond Blue, Lifeline in particular, have done some media recently about the impacts on their call rates in Victoria. They've been in some cases 20 or 30% elevated month on month this month. this year versus the same month last year, and so on. And that's right and observed. At our health service and system level, we're then observing ED presentations, observing the reasons for presentation, the reasons for calling and seeking help. And again, we've seen an increase and an elevation in that globally. I might pause for a moment and stop on the stage 3 restriction we observed in the first part in Victoria, then coming out of that in stage 3, the second part. In the first part, we saw a drawback from help seeking. We saw a drawback from the community mobility. We saw a drawback from people attending emergency departments. We saw a reduced call on bed-based services and admitted-based services effectively. And we turned our work and effort in our service system towards a telehealth and a digital health modality to help and enable that. And so we were able to see and observe data where we were watching face-to-face contacts decrease, we were seeing tele-contacts increase. What became important as we moved out of that stage 3, phase 1, was a lot of feedback around telehealth and substitution completely to face-to-face does not work for everybody. It does not work necessarily in relation to assessments and the fine detail assessments that might need to be undertaken for somebody. It's certainly adjunctive at best for a cohort of people rather than a modality of choice or even preference. So, we were sitting and working with that as the outcome and reality and making our way through that. And of course, Victoria is where Victoria is now, moving back into stage 3 restrictions and now into stage 4 in some cases. With stage 3 the second time, we did not see the same amount of reduction in access to services. And I would posit that it's reflective that the community at large didn't show in stage 3 the second time the reduced mobility that we saw in stage 3 the first time. So it's reflective of that, that we saw, again, an increased attendance at emergency departments, an increased need for admissions to bed-based services and supports, increased calls to helplines and services have continued. We're certainly observant and working with our Commonwealth colleagues around particular cohorts. Younger people are certainly a focus of concern and or of interest in any way, shape that's framed, and observant to all those ideals. In terms of responses, the government has 2 key packages that it's implemented in relation to respond to the mental health components of COVID. There was a $59 million package in April, which in the first instance that looked at the broad population, effectively the population accessibility and requirements for access to telephone lines and support structures, etc., to look at targeted populations to support key and leading organisations for the LGBTQA+ community. Aboriginal community responses are important. The lived experience leadership organisations, our peaks, our Tandem and our VMIAC leadership organisations, helping and enabling. There was a degree of innovation also in that first package, innovation to help health services and providers, both drug and alcohol and mental health community-based providers, access IT, purchase IT and the necessary equipment required to start that connectivity in a remote sense. We also have some innovations helping health services, particularly broker phones, packages and data. Again, a key gap is the digital divide we observe and we experience, so we need to bridge that gap. And we also saw some innovations for younger people through the Origin digital innovation and building not an app, but a platform for genuine web-based interaction between the consumer and clinicians in ways. In that first package, there's also some stimulus to important Royal Commission recommendations to help accessibility of the system. And that continued on in the second package in May of this year. In particular, a focus on the hospital outreach follow-up program, HOPE, it's known for those that attend emergency departments, and expanding that across areas of the state, and support for the commitment to 170 beds that the Royal Commission has made as well. And our colleagues in Mental Health Reform Victoria are leading that. We've worked on building with the National Cabinet framework and endorsement, the National Mental Health Pandemic Plan, for us to share data in ways across jurisdictions we haven't always seen, for us to work with the telephone lines, to work with the community-based sector through PHN-funded organisations, and work with hospitals and create some continuity. And I'll give you a micro example of that in just a moment. Right now, we are looking, and the government is working hard on the idea of that acute end of the system. As I mentioned before, the presentations to the emergency department, the help seeking, to triage into urgent and acute services is important. I'll spend a moment, if I may, just on a concrete example of the public housing towers, and one of the observances we've made as a result of that, where we brought together to respond to that environment sitting in the north and west of Melbourne in the first instance, but focused down on the public housing towers, the lines, Headspace, PHN funded services, community health, community mental health, and acute mental health services in ways we haven't done frequently before, in fact, very rarely. And it was a really salient example, an instance for us to understand that we needed to have that system end-to-end in a stepped care model conversant and connected. And so to acknowledge our colleagues from Beyond Blue and Lifeline and Kids Helpline. I mentioned Headspace and eHeadspace and Headspace National and our PHN colleagues and our Royal Children's and Melbourne Health on Zoom meetings and on Teams meetings coming together, talking about in a unified way a structural response. So there's certainly a degree of targeted responses, there's a degree of population responses, and there's a degree of ongoing attention through working with the national body and the National Mental Health Plan to the issue of modelling and understanding the potential impacts into the medium and longer term. I'm sorry, I had 10 minutes, so hopefully I've covered off.
Sorry, I was just going to jump in and ask just a couple of really specific questions. I'm not sure whether or not you can answer them, but thinking for many people on the webinar who will be working with others, and it was, can I just acknowledge as well, it was really great to just hear give the public the sort of the shout out on the public housing estate, where I know, for example, looking at community health in that particular example, I know I think more than half of the people who live on the estate, proactively go to CoHealth as their community health provider. They know them, they trust them. So it's it's around that balance around the capacities of organisations to respond, but also knowing, well, actually who is best placed to respond, because they're already known and trusted by their community, and CoHealth in that instance. And there were others such as Star Health who absolutely stepped in and assisted enormously, I think, in that as well. In terms of for people who, for many of our community sector organisations, they are dealing with people who have just lost their job, they're feeling particularly isolated, they're feeling scared. I guess it's some advice in terms of where's the first port of call, because often for someone who's in that situation, they actually don't know where to go. The answer might be a little bit different depending on place, but I'm thinking for people on the webinar, they're the sort of questions we get about actually, look, we hear all the systemic stuff, that's great, but actually what does it mean? If someone comes to me and they need a hand, where do they go?
Absolutely, excellent question, Emma, and a really practical question. And again, framing it to the response and the experience that somebody's never had that experience before. They don't have an established pathway. So a GP is always a logical pathway, and we don't often think of our GPs, given we have them, and I know they're hard to get sometimes, but that's certainly a conversation worth having with an individual. I think secondly, in a population sense, our colleagues at Beyond Blue, Lifeline, etc., are structured and set up to help people in a navigation sense, to help them think through what might be going for them. They've got capacity for phone line directly, web-based services and text-based services as well. So they're really expanding their service offer, which is not necessarily just a telephone in a didactic sense, but it's also a degree of complementarity there. We also have built in a psychosocial recovery service. So it's a bit of a midpoint service, so using NEMI, AXO and each, three key services that have played a significant role in Victoria to help navigate through the NDIS. They have capacity to help in navigation, and so the Partners in Wellbeing program is an important one. And I can send some information through to yourself and your organisation for distribution.
Thanks,
on this.
Matthew. I am going to stop you. I was going to say, I'll just stop. I might have got Andrew on, and I think he's only with us for a very short time. So if I can just sincerely thank you for stepping in for us today. Mental health is one of the key, I mean, there's so many key issues as we sort of traverse through this pandemic, but it is one of the key issues. So we're going to look forward to working with you. It'd be great if we've sort of got questions that we need to deal with offline, if we can do those and then provide them to people who've registered for the webinar, that would be fantastic. But if I can say a really sincere thank you to you for joining us today. And I know we mixed times around a little bit, so thank you for being so accommodating. We really do appreciate it. Have a lovely rest of your afternoon.
Thanks, Emma.
Thank you so much. We now have Andrew Crisp joining us. As I mentioned earlier, Andrew is well known to, I think, everyone in the Victorian community sector and everyone in the Victorian community as our Emergency Management Commissioner in Victoria, and has been very kind in making time for us today. Welcome, Andrew. It's great to have you here. Thank you.
Good to join you, Emma.
Thank you so
everyone.
much.
Whoever everyone is somewhere out there.
This is a new way, isn't it? Zooming on in. The kind of key things that I'm mindful things, we've talked before about how quickly things are changing. Did you want to kind of kick off with a sort of the key intro before I get into some specific questions around some of the key work that I know that you're undertaking as well?
Yeah, thanks very much, Emma. Look, for me, when I look at what my role is as the Emergency Management Commissioner, so in effect, it's really to make sure that everything's coordinated, that there's effective control in relation to this particular emergency. So working with the State Controller Health is ultimately responsible for this current emergency that's confronting the state. So really important for me to ensure there's appropriate structures in place. So my focus has been very much around doing that. So specific operations. So I can rattle off a whole lot of names. So, Operation Soteria was the operation for returning international travellers. So the hotel quarantine program. Benesseri is the operation that was put into place when there was a need based on public health advice to, I don't like the term, but lock down the public housing towers. Then there's Drazi, which is a testing operation that's now expanded. I guess the point I want to make in relation to those operations is they sort of started as one thing and have morphed into broader operations. So Benesseri is a good example in relation to North Melbourne and Flemington. This started very much in relation to those particular communities, and they are communities. But it was then about, well, where could there be other high-risk settings where you have a lot of people living in close proximity? So, again, I know Aguirre will speak to this. I think he's on after me or on later. But the work that they've now done to expand that particular program and being very, very proactive in relation to other areas, not just public housing, but other sensitive settings around accommodation. And I'd suggest that the proactive work they're doing now has been really, really effective. Again, we won't say we're a long way from being over this, but in terms of not seeing as many new cases in public housing is a credit to so many people that are now doing that proactive work. And for me, in terms of structure and where we're going, it's very much about that. It's about, what is next? We already know we've seen significant cases in abattoirs, in poultry processing plants, and a number of other settings. But we need to get ahead of that. And I'm sorry, that's why I was late, because of these new directions and restrictions that have come in relation to businesses now, and those high-risk businesses where they need to have their COVID safe plan. We need to ensure that we work with those industries, but at the same time, we need to be able to enforce where we need to enforce. So again, setting up another operation in relation to how we do all of that. So for me, it's very much about sort of the structures and make sure we're all coordinated. And I'm here at the State Control Centre at the moment. So, the leads of all those different operations every day are speaking to each other. So for me, it's a lot of sort of pulling things together to make sure that there's structure and there's coordination, but at the same time, being very, very conscious of the fact that, I'm not working in a bubble. We are talking about individuals. We're talking about communities. We're talking about community organisations. And I know, Marcus was saying then, and Aguirre will say, that we're all learning in relation to how better we can work with community. But the important thing for me is sort of not throwing the baby out with the bathwater. We do it. We've got VCOSS and all these great organisations. We've got local government that plays a critical role when it comes to emergency management. So we need to keep going back to, what are our systems, what are our processes and what works, And I'll be frank, I think that we've probably, at times, we've not reflected on that and gone, well, actually, if there's more that we can be doing at a local level to support local government or local organisations, then we should be doing that rather than setting up something that's new. So that's, I guess, that's how I keep testing myself in relation to every time we twist and turn in relation to this particular emergency.
Thanks, Andrew, and great to hear. I know I've had the pleasure of meeting with you previously and talking about that really critical role of community sector organisations as well, and just organisations that exist within local community and so deeply embedded and trusted in their local community as well. I don't know whether we'll chat to you about this as well, but was there anything, because you touched on the public housing estates in Kensington and North Melbourne, and wondering out of, whether you could give us an example, some of the learnings, I guess, in terms of scenario planning for, as you mentioned, whether it's public housing estates, rooming houses, student accommodation, etc. Any kind of key learnings that you can see sort of straight away that are pretty systemic, but I guess both systemic and place-based in terms of what would be taken to really inform any sort of future approach where there's a concern around COVID in those environments?
Yeah, look, thanks, Emma. It's a good question. And one of my takeaways, we always talk about sort of, community-led, state-supported, and don't get me wrong, there is a lot of good work. But what I saw, and I was so pleased with, and it took a few days to get there in North Melbourne, was actually, when we set up our emergency management structures, we talk about an incident management team or an emergency management team, where you've got your traditional uniforms and your other key players. But what we had at North Melbourne, we actually had community representatives in on that incident management team. So, they had a voice at the table. They were influencing the work of the other agencies and organisations. So, if there's one main takeaway for me, that was a great example about how it actually works. I appreciate also that at times who is the right person or persons, and that can't get too big because it needs to be very focused. It needs to be very snappy with what it does. So it can't be a community meeting, but at the same time, it's a great start in terms of how you get community at the table with I guess the traditional uniforms and emergency services and the key agency, the lead DHHS on this, about actually feeding in that community voice.
Yeah, and lots of learnings, isn't there, in terms of looking at taking to the next response as well. I'm wondering as well, and feel free to guide me if you're not the correct person to answer this question, in terms of looking at workforce shortages as well. So when we look at, for example, residential aged care, I guess is a prime example right now, but looking at, we're starting to hear similar questions in other sort of settings. So for example, looking at residential settings for people with disability, out-of-home care, etc. And if we have one of the people who live in that facility test positive, we then have to look at how we work with the people who live there, isolating the set of workers, and then that sort of surge capacity within the workforce. So really keen to know what sort of work EMV and yourself might be doing on that front as well.
Yeah, again, that's that is just such a critical factor. So, this as we know is an emergency that doesn't impact on infrastructure like a fire or a flood, but it impacts on people. And I know that's quite simplistic, but it is, and we saw that very much so when it came to aged care. Interesting, if I step back, you probably 4 months, we knew there was every chance that we would see. We didn't want to see, but the possibility of positive cases in aged care. So we sort of scenario tested that, tabletop exercise, and we went to sort of the roles of different organisations, what they would play. And it was interesting because there was talk about workforce, but it didn't go to the extent that we've actually seen now that we had these positive cases in aged care, where and I would never judge anyone, and I could quite well understand that some people just don't want to go to work because of a positive case in a particular setting, whether that's aged care or anywhere else. And we saw some of that at the public housing towers in North Melbourne and Flemington. So I guess we've had to sort of rethink what that looks like. And when we talk about workforce, it's everything from cleaners, if we're talking aged care and other facilities, through to the medical support that's actually required. And we know that it's so important to keep people, and particularly in aged care, in their facility. So it's about, we know there's inherent risk in moving the aged to other facilities. So it's about what supports can you bring into to support people in that particular setting. So there is a lot of work happening around that, and you touched on disability, and we're very focused on disability with a task force looking at that at the moment. So so there is a lot of planning around workforce, whether that's in relation to specific departments and the roles that they're playing. Again, that last meeting I just came off, it's happening all the time. How can we, there's some redundancy in some departments because they're not doing business as usual, but how do we pull those resources basically into the centre and task them to where the greatest need and the risk is? This is all about workforce.
That's right. And you touched on a couple of really key things that members who are listening in will be knowing we've had conversations about around terms of looking at how do you divert your workforce, but also that critical need when you've had a case, but you actually need to make sure that that facility remains staffed and dealing at the same time with what can be very real fear that people are feeling at the same time. It's a fine balancing act and a sense, I think, of real fragility that sits around that as well.
Sorry, you're right, and we probably, and I've, we continue to learn, and I've learned. I didn't realise what a casualised workforce that we actually do have across particular settings, whether that's aged care or the abattoirs, and the movement of people. So labour hire companies transporting people from the western suburbs of Melbourne into Western Victoria working in abattoirs, and then what impact that has, and where people are actually where they are living at those or close to those sites, the high number of people living in those particular settings. So again, learning an awful lot around this, but we're doing that thinking. So what does fruit picking look like? Where are the other settings where we're likely to see lots of people in close proximity when it comes to living?
Yeah, absolutely. And something that's probably separate to yourself, but one of the things, we would love to see come out of this, I guess, is that sense of, the recognition around the enormous professionalism that there is around the community sector. This is, if we ever needed a light shone on it, from our point, I think everyone listening to this probably already knows, but the critical role people play, and that often it's just not valued to the degree it should be. And we're seeing the very gendered nature of that as well. Just lastly, because I know you're really busy as well, you sort of talked to, when it came to public housing estates and the role that the community sector is playing in terms of looking at the decision making. Are there any sort of final comments that you'd like to make on that, or do you feel like you've sort of covered that off?
No, I just think there are more opportunities. And again, Emma, I'm always happy to catch up and sort of learn a bit more about, in our state emergency management structure and arrangements, there's, Municipal Association Victoria, sit on our state emergency management team, local government Victoria, So if I look at that very sort of localised example, when I talked about, local voices on that local IMT, what more can we do to sort of get the right voices informing and influencing more at a state level?
Yeah, fantastic. Thank you. Thank you for your time. I know you are just so incredibly busy, and thank you for the work you're doing on behalf of all Victorians as well. We're just enormously grateful and very thankful to you for making time today.
No, please. No, it's all about what everyone that's watching this is actually doing on the ground. So please, I always just talk about a big team. We're all part of a team. Doesn't matter whether you wear a uniform or not, whether you're the most junior person, the most senior person. As long as we all perform our role to the best of our ability, we'll get through this.
Exactly right. Thank you so much again, Andrew. Have a great rest of your day.
Thanks very much, Emma.
Bye.
Take care, everyone. Bye-bye.
Thank you. You too. It's now my significant pleasure to welcome Simone Corrin. Many of you will know Simone, who's working on community sector support and responses during the pandemic. I've been very fortunate to work closely with Simone during this time as well, and know that she is working hard across the whole spectrum of issues that DHHS is dealing with as well. So Simone, did you want to sort of kick off? I know I almost wondered when I was looking at this, the running sheet, I was thinking about the broad reach of things you're working across at the moment. Did you want to kind of give us some of the, I guess, for those people who are listening, a kind of key sense around some of the key issues that you're working on at the moment as well?
Thanks, Emma, and thanks for having me here today in my lounge room, joining you all.
We're all from our lounge rooms, don't worry.
I know. Yeah, there's so much going on, and such a breadth, and I guess we are, as the department, trying to make sure that we're able to support the community services sector in all of the work, that the really important work that people are delivering, and keeping up, I guess, with the rapid turnaround of advice and restrictions. So I acknowledge that it's a really tough time for all of us, as we, particularly in Metro, move into stage 4. And I think, Emma, you were talking before about where do people go to find the right information. So we're working to make sure that we can get that information out, because as we know now, people are needing to have COVID safe plans by midnight on Friday. We think that there's been significant work undertaken by the sector to develop those plans already, but I'm very happy to share, so that you can send out to people the places on the department's website where they can keep that, where they can access that information, I should say. Obviously, also the requirements now to wear masks, and so when across community services sector when working, and now the need to have permits for people who are required to work on site. One of the key things that we're also working to is acknowledging the significant issues around mobility of workforce as one of the significant risks. So I will just call out that there is a working group that we've established that is particularly looking at that issue, specifically in relation initially to our disability services and looking at the risks of that. We're working with our colleagues in the NDS, National Disability Service in Victoria, but also our colleagues in the Commonwealth in terms, and our providers, to do the modelling to understand the implications of the workforce mobility, and to understand how we can risk tier that, so to support people in terms of understanding the implications of that across their workforce. And we will have a framework, we expect about that early next week is our plan. So there's a lot of work going on across the multiple sectors, and I think that it's probably worth perhaps just reflecting on the work going on in the disability services space, because we absolutely are seeking to learn from what we have all seen, unfortunately, unfold in the aged care services, and seeking to ensure that that we don't see that repeated for our people with disability and our providers in that sector. So we have set up a disability rapid response group, and that's something we've set up in the last couple of days. We're working very closely, as I say, with our colleagues in the Commonwealth, in the NDIA and the Quality and Safeguarding Commission, as well as staff across public health and other areas, to really ensure that we're supporting the prevention and the preparedness activities through the coordination of visits to the disability residential services, and making sure we get the right information out there and being able to act early. So the key things that we're looking at is, in addition to being able to act and get the right people in place to support our services in the sector, are around those workforce issues. So the workforce mobility question, and the issue around that surge capacity and the capability to be able to bring people in when we need to provide those services and ensure people get the care and support that they need.
Fantastic. Thanks, Simone. In terms of with questions, one of the key ones I've mentioned earlier, I'm not sure whether you're online or not, but we have had so many questions from members about whether they're a permitted industry, whether workers fit under a particular category that enables them to be work, and understanding at the same time that this work is just moving at pace. I think I saw emails coming through at like 2 o'clock in the morning around work that people were doing. So I really do want to acknowledge that as well. I guess for people who've got those questions, I'm mindful some of them are coming to us. We certainly don't know the answers as you're working through them. Is there a particular place that people can go to ask those questions and feel confident, I guess, in the response that they get, to think, yep, I've been told we're permitted, I can issue a permit, I know that, you know, I can feel confident in doing that?
So there is a website now that has all the information about permits and question and answers in relation to that. So again, happy to send that link so that people have got access to that. The other thing that we have done recently, and happy to also share, is a website where, an email address where people can come into the department to ask some of those questions that we're able to respond to those. I'm just trying to see whether in amongst my paper here that I can find the location to give to you, but I think it's
we can share that as well. We can put that on our email. We can put that on our website straight afterwards, so don't feel too worried if you can't find it straight away. I'm mindful we've got lots of questions for you, and expecting you to have everything at hand when you've probably been up all night is a very unreasonable thing. So we can put that up on our website straight away and make that available to people, because I think it's one of the questions we've had, as you no doubt have, over the last few days. We've just been inundated with responses of people saying, well, I don't know. And now with the extra layer of childcare over the top of that, and people are really concerned about wanting to make sure they're doing the right thing by their staff, and wanting to make sure that no one's attracting fines and all those sorts of things, at the same time thinking, if it's left to individual interpretation, people are just worried that they'll make that there'll be an error for which there's significant costs attached at the same time, and working at pace to change things really fast, I think, as we can all empathise with. I know we've had part of this conversation before as well, but in terms of staff who need to travel across borders, which is one of the challenges we've had as well, is there any sort of more recent advice that you've got around that, knowing that for some of the people listening, they do have to travel across sort of border areas or in and out of stage 4 and stage 3 areas, for example, so Metro Melbourne to regional Victoria, or regional Victoria, to New South Wales, for example. Any sort of particular advice that you've got on that front as well?
I think that's right, Emma. It's difficult in terms of being able to navigate some of that space. So I think in terms of the cross-border, like the New South Wales, South Australia type cross-border issue that we've got at the moment, my understanding is that in fact people have been able to start to navigate that quite well, that the permit system up there is working quite well, and people are readily able to get the permit that they need, which they have to reapply for every 14 days. So it does make working difficult, and I know that people are changing their arrangements to make sure that they are working out which staff and which families are able to be supported on the sides of the border. But it is around having that permit with you, and the same, I think, now in terms of particularly anyone who's crossing from stage 3 into stage 4, having that permit from work to be able to say that you are working for a permitted reason.
Yeah. And the other thing just to mention as well, because I did see today as well, just looking at the updated advice around permits more generally, just making sure that people are aware, if you've got a staff member with a permit, the fact that they need the permit that needs to be signed by the employer and the employee, and they also need photo ID. So I just thought that was worth calling out, because I noticed that today and thought, I'm not sure that that's broadly understood. And my understanding is also, so correct me if I'm wrong, that the employer gives that permit to the employee. It doesn't fall on the employee to generate it. That's correct, isn't it?
That's correct. Yes, it's the requirement of the employer to provide that. Yes.
Yeah, thank you.
And people can have that on their phone or mobile device, so it doesn't have to be printed, and we prefer probably that it isn't at the moment. So yeah.
Absolutely. No, that's great clarification. Thank you. In terms of masks, are you able to briefly talk about, we've had conversations as well about specific issues for people who are deaf or who have hearing impairments, and some of the general advice that's going in terms of masks in particular in that instance?
So yes, there's quite a lot of work being done in terms of trying to clarify, particularly for the issues in relation to masks for people with disability. We are making sure that obviously all of the advice going out is accessible information, and we've got a core group that is working to develop that. But there are situations where when you're in a home setting or providing services where people don't need to wear masks, where people need to be able to lip read or to be able to have access to be able to understand what people are saying. But also we know that people more broadly needing to be out in the community and interacting with people. And so it is permissible to remove your face mask if you are communicating with a person who is deaf or hard of hearing, where the ability to see the mouth is essential for communication. Obviously maintaining physical distancing as part of that, and as you, I think, referred to earlier, thinking about Auslan communicators and others. But yes, there is also work that is being undertaken to think about people who can't wear masks, and thinking about how we make sure that they're not stigmatised in that process. So there is some work underway actively at the moment, where we're working with partners, including Victoria Police, about what that looks like. We don't have the magic solution right yet, but we are working really hard to make sure that's in place.
Thanks, Simone, much appreciated. And one last question, in terms of how can organisations access reusable masks to distribute to community members?
Thank you. So there are a couple of ways to do that, and again, I'm very happy to share the link. So there is a place that you can essentially place an order. So if you're a community service provider with vulnerable people, then you can place an order. At the moment, as the reusable masks are actually being manufactured and distributed, disposable masks are being provided in the interim, but it is from the department. There is also opportunity that people can get them from their GPs and their community pharmacies as well, but the department is able to send those out.
Thank you, Simone. And if I can say a huge thank you, we've been working quite closely together over the last little while, and I know that I'm not sure that you're getting any sleep, I have to say, at the moment, as you're working on all of these issues and working really quickly to try and resolve things as fast as you can in an ever-changing environment. So sincere thanks to you, and thanks for coming online today as well. We really appreciate it and look forward to seeing you soon. So thank you very much. Thanks,
Simone.
Emma.
Thanks,
have a great
everyone.
afternoon.
See you.
We're now joined by a regular participant in our VCOSS-DHHS COVID-19 webinars or forums. We started off with 100 people in a room, and it feels like it was about 3 years ago, as we're now all fully zooming from our lounge rooms. So we're welcoming Agiri Alexandratos from DHHS. A huge welcome, Agiri. Agiri is going to give us an update on the planning for high density living scenarios, including public housing estates as well. Before I kick into questions, Agiri, is there sort of any general comments that you wanted to make by way of kicking off?
Hi, Emma. Great to be here, and lovely to see you and the team, and thanks for continuing to do this webinar regular engagement with our sector partners. This is an incredibly valuable opportunity, I think, just to bring all the key people together and give an opportunity to provide information. So really appreciate your continuing commitment, Emma, and your teams, which is fantastic. And I guess by way of introduction, I think what I would say is that we've been all working incredibly hard to support our public housing tenants. And as you know, the vulnerability, the challenges associated with the physical built environment in high-rise environments means that we've got to take particular care. And we saw the challenge of what it means when rates of escalation in terms of transmission take effect in a high-rise, high-density environment in Flemington and North Melbourne. And of course, the impact of that, where a decision gets made that we have to stem the flow and try and protect lives, means that we had to shut down that whole environment with a whole range of consequences for the people within those public housing estates. And I guess our aim now is to try and prevent that from happening as far as possible. And to do that, we've been undertaking a range of preemptive protective measures that we've been putting in place right across the physical environment. Apologies about the beeping that's happening in the background, but there's another meeting happening in parallel, and Teams is just continuing to be annoying at the moment. So sorry about that.
That's fine.
So on that level, we've really gone hard at a proactive health prevention focus across all the public housing high density high rise estates. for the very reasons about this is about protecting lives. This is about making sure that people have all the right information, that we undertake the hygiene that's required to make sure those environments are really clean, and there's a rigorous hygiene regime that's being put in place. And of course, providing a whole range of supports to the residents, both in terms of testing, provision of masks, provision of sanitizer, and a health concierge model that is there to essentially be the front face of our response with the residents. So these are all really important elements of support that we've been able to put in place. And just to give you some data on the effort, Emma, so we've conducted 9,500 tests across all our public housing high-rise estates over the last few weeks. We're now at 229 active cases across all of those environments in North Melbourne and Flemington. And I want to really emphasise that notwithstanding the challenge of that environment, we started with about 300 active cases at the height, and those numbers were escalating. We're now down to 82, and those numbers continually drop. Converse to what's happening in the broader Melbourne metropolitan environment, and that just gives you an indication of the really targeted effort that we've been able to put in those high-rise environments, and to really protect those residents from further infection, and hopefully as a consequence of that, positive consequence, it's saving lives in those environments. So that just gives you an indication of the level of activity. We continue to have our community services partners working alongside us, providing incredible support. We've had 7,295 calls through our 1-800 hotline, which has operated 7 days a week, 24 hours a day. Over 180,000 masks have been provided across the 57 public housing estates. We've door knocked more than probably 10,000, 11,000 doors across those environments and engaged directly with people. That just gives you a sense of the massive effort that we've been undertaking across those environments. I'll pause there.
Thanks, Aguirre, much appreciated. One of the things that it would probably be good to touch on, I think you've mentioned it, but just to go back in terms of looking at, I don't want to go into the sort of the sensitivities, if you like, of what happened on the public housing estates in the first instance. So really keen to look at the next steps, which you touched on in terms of, I think, hindsight is a beautiful thing. There are lots of lessons learned in terms of what might take place in future. I guess looking at firstly what's in place by way of support for people in Flemington and Kensington, but also the learnings and looking at the scenario planning. We talked to Andrew Crisp about this briefly before, as well as looking at, we talked about the fact that it's public housing estates, but also rooming houses, student accommodation, etc. Looking at the scenario planning that's there, because I don't think anyone wants that particular instance to happen again. And you mentioned, for example, concierges, etc., and others. I'm just thinking that for some people that may not be fully aware of, the sorts of things that are in place. My understanding is, for example, there's a really strong connection with local community health providers that work closely with people on public housing estates, for example. So did you want to touch a little bit more on the sort of scenario planning that you're undertaking? Because clearly the desire is to not have that kind of situation happen again. Clearly driven by wanting to save lives, not quibbling with that for 1 second, but they're thinking about the learnings and how we apply the learnings and how we look at scenario planning for other high density settings.
So much of what I've described in terms of what we've done more broadly outside of the Flemington and North Melbourne environment is really taking the learning, sometimes really painful learning, Emma, and particularly for the residents who've had to endure that sort of lockdown and restraint to their liberty and their access, obviously, and we absolutely want to avoid that. That's why we're putting all of those measures in place. You're right about the importance of deep community engagement, and you know, we meet regularly with the community through a number of different mechanisms. We've got a formal mechanism of a working group that is specifically targeted at the Flemington and North Melbourne environment. You know, you've heard me talk about previously that Viv Nguyen and Tony Nicholson lead that work for us in terms of convening the meetings and bringing all the stakeholders together. That is a main mechanism for how we understand the resident needs, the community, broader community needs, and all of the services that are there to support that need as well. We replicate that now in other estates. So we've stood up an advisory group in Richmond and Yarra for the Richmond and Collingwood estates. We're doing the same thing on the south side of the river as well. So these are elements that we're pulling out from learning, deep, painful learning that we've had in Flemington and North Melbourne, and translating them across to other environments, but not just dropping them in. Again, underpinned by deep engagement with those communities, and that's a method that we've got now rolling out across each of those environments. The physical hygiene, the health concierges, all of those elements are drawn from the experience of Flemington and North Melbourne and now being applied through to the other estates. We absolutely don't want to get to the point of where we got to with Flemington and North Melbourne. That's why we're doing this in a more proactive, in a more planned way, and with the right community engagement models that we've got in operation. And again, we are iterating the approach on a regular basis based on the feedback that we're getting, based on the intelligence from our community engagement, and importantly, being able to, in a really agile way, deploy in a targeted way when the data, the public health data, indicates a spike of activity or transmission, and we're looking at that data on a really regular basis, on a daily basis, in fact, to really make sure that we're tuning our strategies. You touched on other sensitive accommodation locations, rooming houses, backpackers, hostels. We've been involved in SRSs, and we've stood up a whole cell that essentially is about proactively managing and reactively managing once we see an escalation of outbreaks happening in particular locations. We're using our community service organisations to support our relief and support effort. We're using local government areas to really give us that support. And importantly, we're using our health services and our community health service partners to really pull that effort together right across those environments, both in the public housing environments and in those other sensitive accommodation environments. Thanks,
Aguirre. I think it's really helpful just to touch on, as you say, what is a really iterative process and lessons learned. And it is that balance, isn't it, between what's a systemic, more of a sort of systemic approach, and then that place-based response as well, knowing that it's being mindful of you know, what's occurring in each environment, and who are the community groups that are most deeply embedded within each community as well, which of course are going to look different.
Yeah, absolutely. And it's fair to say, you know, we've had some difficult conversations, really challenging conversations. And last night was an example of that in Flemington and North Melbourne, where it was a hard, painful conversation to hear residents talking about their experiences and wanting to elevate the voice of residents within the context of what's occurred. And particularly as we try and pivot towards an environment where we want to take a different approach to the way that we support residents and manage our tenancies, and think about a completely different operating model coming out of a crisis, and taking the opportunity to essentially reconceptualise the way that we undertake tenant support and tenant management.
Thank you. Thank you, Aguirre, as always, for joining with us today, taking questions. And I know I'm also very mindful, I think each time we look, everyone in DHHS has taken on a new role in response to a new and emerging issue as it comes to COVID as well. So again, appreciate the support, and also the fact that we can have really kind of candid conversations around what's working, what's not, and how do we fix it? Because fundamentally we are all in this to say, how do we navigate best through this time together? We will get through it. We've got to do it together. So thank you to you, and you know, the role you've played in terms of working, you know, as a key partner throughout this. It's just enormously valued, and I want to pass on my really sincere thank you for that as well, Aguirre.
Thank you, appreciate it, and thank you for everything you do as well, and team. Thanks a lot. See you later.
Thanks. Have a great afternoon. Bye. Thank you. And our final speaker today is Jerome Weiner from DHHS. Jerome is primarily, I know you've had changing roles as well, Jerome, but primarily involved in terms of community engagement with communities across Victoria, and particularly as it comes to testing. So it's fantastic to have you here today. I might ask if you wouldn't mind just giving us a quick sort of snapshot around the key work that you're undertaking at the moment. That would be great. Thanks.
Well, and good day, Emma, and well, thank you for giving me a bit of time to speak with you all today. Yes, like Gary, I've been in this role for not as long as he has, about 3 or 4 weeks. Previously, I was a CEO at Public Transport Victoria and VicRoad. So I come at this from how do we work with the community in this critical service, and how do I support the public health people to work on our strategy to suppress and eliminate COVID. So to my current responsibilities. The focus really is around probably about 3 things. One is there's the sheer mechanics of running a very large-scale COVID testing program. We have around 189 different COVID testing stations all across the state. Obviously, a huge number within metropolitan Melbourne, and those are run through a series of public health facilities, hospitals, and clinics, and so on. Various Commonwealth clinics, respiratory clinics, GP clinics, but also a number of different retail pop-up sites. So we've located those both in terms of the high volume retail drive-through sites that we tend to see on the evening news in places like Flemington and Keysborough, but also local community pop-up sites in key areas to ensure that particularly vulnerable members of the community can access those services effectively. So that's one part of my remit. Probably the more important part of my remit is how do we work with the whole Victorian community to actually provide good access and to deal with any barriers that exist to getting tested. And some of those barriers, like my old job, are physical. So we obviously have many Victorians who will struggle to access some of our testing facilities. We've just launched literally 2 days ago our new call to test program, which enables any Victorian to call our COVID hotline, and if they meet accessibility criteria, so if they're not physically able to leave their premises for health reasons, and if they're triaged as needing a test, if they're symptomatic, then we can arrange for a nurse to come to them to conduct a test. Now, clearly, we're trying to target that service very clearly at those who most need it, the most vulnerable, the most in need. And we've been, overwhelmed over the last 2 days with demand for that service, which has been, I think, a really.
I can just say that's fantastic to hear, because one of the key things I've heard, particularly, for example, with people with disability or those who can't drive, one of the key challenges is, particularly if they're symptomatic, they don't, they're kind of looking at, well, how on earth do I get to a testing site? That's so that's great to hear that.
That's right. So at the moment, it's based around a nurse to home model. And obviously, we're very keen to focus on those who are genuinely housebound and who genuinely have real challenges that we need to attend to, and to ensure they're symptomatic. So there is a GP referral element within that phone service. But I think it's, as you say, Emma, really important to give the most vulnerable access to that critical testing service. So the other piece, of course, for us is we're dealing also with social, cultural, and language barriers around accessing testing. So we provide lots of information in multiple community languages. It's about 55 community languages on our website. But we also know that there are certain groups who are harder to engage with. If you have a symptom, please go and get tested. We know that ranges from from otherwise healthy, robust young men in their 20s and 30s who don't think it applies to them, but it also relates to particularly newly arrived migrant communities, people who may have other concerns about the state coming in to get records from them, to get details from them, and all we want is your clinical information to see whether you've got COVID or not. So we're having to work very carefully with people in the way that Argiri is in his environment, around how we give people confidence this is just about testing, it's not about anything else. So there's a lot of outreach that we're doing in that space. And the third area, and then I'll hand back to you, Emma, is around we've got also not only vulnerable individual communities, but also vulnerable settings and high risk settings. So what we're seeing with the penetration of coronavirus, particularly as we see more and more community transmission, is it's happening particularly in 3 different settings. Firstly, it's happening in the social housing setting for reasons like we would have gone through. It's also happening in aged care because we know it has a very mobile workforce. We know that's often a vector for it coming in. And of course, people within the aged care setting are very vulnerable around any impacts of COVID. But thirdly, it's also happening in high-risk workplaces. About 80% of transmission is happening in the workplace. And we have certain workplaces, like particularly the abattoir sector, the whole food distribution sector, commercial laundries, where we see it's a very easy environment for COVID to be transmitted. And also it often involves some of our very vulnerable workforce, either workforces that are living in very high density premises, or that may be being bused significant distances, or that are working across multiple work sites. So we're working at the moment with both employers and employee groups around how we can reduce the risks in those high exposure settings, and how we can manage any outbreaks that are happening in those locations.
Yep, fantastic, thank you. And I think there's a part, and we touched on this earlier before, it's one of the challenges we have in our sector is, a highly, fairly low paid, highly casualised, precarious workforce. And this is really shining a light on actually how we need to make sure that people actually have enough pay through their work to be able to make ends meet in the first place, so we're not put in this position which puts them at risk, and in this particular instance carries that risk more broadly as well. And recognising, I think, the really critical core work that people do in our community that we can't overlook. One key thing I just wanted to touch on, I know we're really tight for time, but in terms of looking at, you mentioned earlier around sort of called communities, really keen just to touch a moment on the sort of translation and other supports that are in place for people who speak a language other than English when they go to get tested. Is that something you're able to speak specifically about as well?
Yeah, absolutely. So we have a number of different tiers by which we do that. So there's a heap of information on the DHHS website in multiple different languages. I'd say about 55 languages that talks about the nature of the coronavirus and how it impacts people and what to do. If you have any kind of symptoms, please go and get tested, and here's where you go get tested. We're also providing a lot of resources to our partners in local government and in local healthcare providers. So there's a lot of information through your local community healthcare clinics, through your local hospitals, through your local GPs, but also through local councils. What we're starting to do, Emma, and look, I think we've got a long way to go yet, is we're starting to also work with local community groups. I think, and Agiri's got some really great examples of that. We're starting to work with some communities in places like Wyndham Vale, where we're working with local community groups and local community leaders to say, well, how can you help us communicate with members of your community? What support, training, information can we provide with you, and how do we get it? How do we most get it to you in the most effective way? So we're starting to get into that space. I think we have a lot more to do in that area.
Yeah, which is really great to hear that's underway, because I think one of the key things we all know is the digital divide is really significant. It's significant particularly in low income areas, but it's often a real issue as well for people who don't speak English, who, for a whole range of people actually, in terms of just not having easy web access, issues around access at all, or whether you've even got a device. And I know with one of the community groups that I work with, very particularly, for a lot of people who we see they don't have an email address, they don't know how to use the internet. So we've got to make sure that we're actually able to get to every part of the community, and it is often those very local community groups who are best placed to help there. And just in closing, at the moment, I'm not sure whether you can comment on this more generally, how long are people kind of on average, which might be a trick question, waiting for a test result at the moment?
So look, at the moment the average is just under 2 days, about 1.5 to 2 days. Now it does vary. I hasten to say that there's quite a big distribution, and the reason for that is that we do prioritise high priority cases, and they can be because of either the housing work that Agiri is doing tends to be priority cases. Obviously, healthcare workers, people who are in critical occupations, will be treated a bit quicker, and those priorities are allocated at the point of testing. So on average, it's just under 2 days. I know there are examples where it's taking 4 days, sometimes 5 days to get test results. We have a lot of work happening now to bring it all back in well under 3 days, because that's really where we need to be. And we do recognise that it's a difficult message for people, that what we're asking you to do, if you have any symptoms, please get tested. But once you've been tested, you must self-isolate until you get your test result, because you may be positive. That's why you had a test. So we need you to self-isolate for the hopefully 2 days before the test result comes through. And most of the test results will come through as a text message. But again, as you say, Emma, we're having to explore other ways of getting hold of people to give them that information, because we know not everybody has a phone, and there are there's more for us to do.
Absolutely. And really key to mention as well, for those people who do have to isolate, and often at short notice, that there is help there in terms of basic sort of food packages, etc., that can come through. It is such a critical message if people are being tested stay home, and we've got to make sure that we're doing everything we can to support people in terms of doing that. Jerome, can I say a huge thank you for your time in joining with us today? As you said, I know you've been with the department for a short while and come in, hit the ground running. So look forward to working more with you, and a huge thank you for all of the work that you're undertaking as well. Much appreciated.
Absolutely.
Thank you for your
Ella.
time.
Thank you, everybody. Cheers.
Thank you. And if I can finish with a few thanks in terms of, firstly, obviously acknowledging that we are in rapidly changing circumstances, and again, thanking the community sector organisations who are at the forefront of response and always looking to deliver the very best possible for the Victorian community as well. I would like to sincerely acknowledge and thank our colleagues at DHHS with whom we run these webinars, the really extraordinary partnerships that we've had, that I think are partnerships that we've had in the past, but we're really seeing how important they are when we hit really critical times, such as those that we're seeing through this pandemic as well. We know that things are changing rapidly. We're going to continue to get information out to the sector as soon as we possibly can. I know the last few days is one illustration of that. As we've moved into stage 4, as I said, we were getting emails at literally 2 o'clock this morning around some changes that have occurred in terms of looking at permits and permitted industries, etc. We will work to get that information to you as quickly as we can. And I know that collectively we are undertaking a true powerhouse of work, and we will get information to you as quickly as we can. We'll put it on our website. We'll make things as accessible as possible. Please do not sign up to our e-news bulletins if you haven't already. Often the information that you may require is there. We will get you information that's come out of today, particularly where, for example, you've got scenarios that are particular to your workplace, where you're going to need, direct help from DHHS in navigating, what does directly apply to you on that front as well. If I can also finish by acknowledging the extraordinary work of the team at VCOSS. The VCOSS team is amazing to work with. I know for pretty much everyone who's on this webinar, you'll be working with a member of our team, and I have to say they are going over and above every day, as are the organisations that we're working with, to make sure that we are getting as much information out to people as quickly as we possibly can, making sure that it's accurate and wanting to collaborate with our members. It's something that we feel enormously privileged to do. So huge thank you to our member organisations. Please, everyone, look after yourselves. We'll see you at the next webinar. We've got them scheduled in each month now. So very much look forward to touching base with you again then. And in the meanwhile, please take care of yourselves. Thank you again for your time today.